Hello, my name is Yaa Kumah-Crystal. I'm a pediatric endocrinologist and biomedical informaticist at Vanderbilt University Medical Center in Nashville, Tennessee, and I specialize in artificial intelligence in clinical care. I think the thing people need to pay attention to is that this is not just a fad and it's not going to go away. And there are really intriguing ways we can use AI to help deliver care, to help surface relevant information, to help us make clinical decisions. But also, our patients are using AI, whether we like it or not. So it's going to be really important for caretakers to understand how these tools work, including their limitations, so we can give guidance to our patients about how to interpret the information they get back. I think the biggest limitation currently still is the issue of hallucinations. And what that essentially means is if the AI does not have enough training data about a certain object, it's going to manifest information based on the math that it understands, but that might not be true with regards to the answer that you're trying to get. And people who are not versed in AI, which is most people, to be honest, this isn't an everyday topic that most people are dealing with, but they won't understand that and they'll take whatever the AI gives them as base truth. So I think the limitation of the hallucinations is something that the folks in the AI industry are continuing to work on to minimize. And there are lots of strategies we can employ also, but making sure people are aware that that's a thing they need to take into consideration when they get information back is one of the biggest goals that I have with regards to teaching people about artificial intelligence. And we can mitigate these too by fine-tuning the AI, giving it more relevant information. For a field like pediatric endocrinology, which is a niche of a niche, there's a lot of gaps with regards to what's in the training data. So I think solving hallucinations is going to be one of the biggest challenges for us. Ooh, I would like to think that having really good algorithms in the background to have a full closed loop system is going to be what the game changer is. My husband, he's lived with diabetes since he was 16 years old. We went to school together. I grew up with him, learned a lot about diabetes. That's what inspired me to become an endocrinologist. And just seeing some of the challenges that he still faces with, his things beeping everywhere, blood sugar is high and low. And I think the more we can teach the tools to better understand our physiology, to understand the full human with all the different aspects, with information about his activity by using like accelerometer data, having a full picture to make decisions based off of that to appropriately dose and anticipate insulin will hopefully make it more of a hands-off experience and let people with diabetes live their lives instead of having to worry about micromanaging every aspect of what they eat. Biggest take-home message, AI is here to stay. To make sure that you're staying on top of patient care, you need to be using tools. They're out there. There are lots of free ones that you can easily use. I think you should give yourself a challenge of 2 prompts a day. So at least 2 times a day, just get in there and either ChatGPT or Copilot or something and put in a question that you had for yourself and see what it gives you back. Because even if that's not an answer you're going to use, it's going to help you understand how these things work. It's going to help you understand how your patients are getting information back. And that's going to teach you how to better shape your questions and how to inform your patients about how to better shape their questions as these things continue to be more of the fabric of how we live our lives.